Welcome to Safe Coalition, Confronting Our Crisis. I'm Dr. Ann Bergen, and I'm joined by my co-host and creator of this series of programs, Mr. Jim Derrick, who is president of the Safe Coalition. A few years ago, two people in our community, Jim Derrick and Jennifer Knight, said, no more. No more sitting around and doing nothing as we watch more and more people suffering from this devastating illness of substance use disorder. Too many people were dying. They said no more. They said we need to get rid of the stigma. We need to come up with treatment options and advocate for treatment options. We need to provide education, and we need to provide support for the families whose loved ones are going through this terrible, terrible disease. So from the efforts of these two came the Safe Coalition, which is now a very, very powerful grassroots effort in our community and surrounding communities because of these two people. And part of Jim's mission was to create this program. And what he wanted to do was to find others also who said, enough is enough, no more, and we have to do something about that. Inviting them to come and share their stories, their experience, their wisdom, so we can all learn from each other. And I don't know about other people, but I do know that lately I've become pretty disillusioned about kind of a lack of courage and leadership from the national level. And what increasingly I'm finding is that heroes are emerging from the grassroots and the local level. And we're lucky, Jim, to have one of those heroes with us today,
Yes,
so I'll let you take it from there.
Yeah, great. Well, thank you for those kind words, Ann. And I just want to say, while Jennifer Knight was tremendously instrumental in founding the coalition, our board of advisors is open to anybody that would like to join us. Our meeting schedule is online. You can go to safecoalitionma.com and find that. So please consider joining us. Today in studio, we are so fortunate to have Mr. Woody Geissmann. Woody comes to us with a ton of experience in treatment, and he is the CEO and founder of Right Turn Incorporated, which is a 501c3 nonprofit agency in Arlington. But Woody also has another interesting experience, and that is he is one of the founders and the drummer for the band the Fuegos, the first band, as I shared earlier, that I ever air banded to. And the Fuegos, just a great garage rock type band, Boston-born, who went on to enjoy really tremendous success in a very short period of time. Woody was sharing with us earlier, they went from playing the Rat in Boston, the Rat Skeller, I think was the name of it, right?
Yeah.
With about maybe an audience of 200 or 300 people to playing Nassau Coliseum literally overnight with ZZ Top. They toured 100 dates with Tom Petty, and Woody was sharing with us just before the show his profound sadness about losing Tom Petty. So we're very fortunate to have him. But then Woody went on from there to become a certified addiction counselor, and he's taken his career and his passion for helping others and developed Right Turn. In addition to his counseling professionals, Woody serves on the board of Registry in Medicine under the direction of Charlie Baker, which is interesting in that you are one of two non-physicians on that board.
An attorney and an addiction specialist.
Right,
yes.
right. So that's a very interesting thing about Woody. The other thing is that Woody is a professional interventionist, and he did just until recently serve on the board of ethics for the Association of Intervention Specialists. So thank you, Woody, so much for being here. We're really looking forward to hearing more about your story and Right Turn. Can you tell me a little bit about how Right Turn was founded? What was the impetus for it? What was the inspiration?
Great question. And good morning. Thank you.
Good morning.
Glad you're here.
Yeah. Well, I had left the music business and left Los Angeles and came back to New England to go to school. Did my undergrad at UMass and my master's at Suffolk University, and began working, I cut my teeth at a state program called Hope House, which was wonderful. And I was gathering bits of pieces of information about what I liked about treatment and what I didn't like about treatment. And from there, I went to work at Cambridge City Hospital for a number of years. And that was certainly an education and a learning lesson for me. And there was a lot from the hospital system that I began to collect, but there were things that I felt needed to change. And from there, I went to work for the Department of Mental Health, where I worked with severe and persistent mental health issues and the interaction of substance use as a disorder with severe psychotic disorder and et cetera. So from there, I was asked to have lunch with Dr. Ann Alonso. Dr. Ann Alonso is one of the most celebrated psychologists, and at the time was the head of the advancement of psychotherapy for Mass General Hospital. And I'm going to say a very scary lady. When she said, "Young man, I'm going to write you a check and you're going to turn on the phones, you're going to open the doors with no expectation, let's just see what happens." And, at this point, I knew that there was this wonderful kind of success of incorporating good therapy and, psychotherapy and psychiatry and evidence-based services with expressive therapies of music and art and creativity. So I hope I answered your question.
You did.
I wanted to ask one question.
Yeah.
You were in the music world out in LA.
Yes.
Did you see kind of a lot of substance use issues there? And was that anything that motivated you to kind of, because usually sometimes you associate with that world a little bit of substance use and things like that. Was that part of the culture that you saw in the music world?
Yeah. So I was, being a musician in the 1980s, was a very different time, and substance use was not viewed as it is today. If a band was in trouble, people didn't rush in to rescue them as quickly as we do today. If you put Southern California and the music business together, it kind of answers your question. Yes, I was surrounded by substance use. I was surrounded by some really a lot of sadness. I mean, we had already lost in the 70s, we had lost some amazing musicians, Jimi Hendrix and Janis Joplin.
That was my childhood, but we lost all of them.
Yeah,
it was just
and
one after another.
And truthfully, if I were completely honest with you, Doctor, I felt like I was the next one to go. Not to put myself on the same plane as Jimi Hendrix, but I'm saying, I was the next. It was a slow train wreck,
Yeah. And so you had a spiritual awakening of your own, if you will. You had a moment of clarity and said, "I'm done with this," which we're kind of backtracking now, but,
but that's
propelled you forward.
Well, it was interesting because, and today when I work with artists and musicians and people, I use that, my own experience, and that is, there's this perception that I thought that substance use was making me a better musician,
right. That's
a
what you
better
hear all the
performer,
time. That's right.
a better songwriter, that I had better ideas, that I had more ideas, and these were all just perceptions.
But that's out there. I mean, that needs to be corrected, because that. I mean, I'm not an expert, but just you hear creative people talk and they feel like comedians on TV, and that they need the substance in order to feel that creativity. But it's just not true. I mean, it can happen without it, as you found, through the work you're doing. That they don't need substances, right, to unleash that creativity, and that.
Right, and as much as I felt that it was helping me, in the end, I was forced to see that it was actually hurting me.
Sure. Yeah, I mean, I've seen it, just socially. You hear stories all the time from parents, and we'll talk a little bit about family illness in a bit, but you hear a lot of stories from parents about watching their young children, or their relatively young children, coping with social anxiety. So they feel like it makes them better in social situations. Or athletes, they think it makes it better, and that's a fleeting and false illusion, which is something that really yields to a dead end street. So that's why we're lucky to have you here. Woody, Right Turn is really a unique place where you're dealing with dual diagnosis. So I was interested in one of the interviews I saw you do, that you in your experience had dealt with both the comorbidity of mental illness and substance use disorder, and the opposite, the comorbidity of substance use disorder and mental illness. Can you talk to me a little bit about how you've seen that play out with your experience? Because I often hear from people, I don't know whether my son's mentally ill or a drug addict, or whether he was he was a drug addict first and became mentally ill.
Yeah. Well, really good point. And, I want to say that Right Turn is a team, and it's a very comprehensive team from psychiatry and a psychologist, neuropsych testing is available if needed. Psychotherapy and music and the arts and a structured program to help people get well. And we believe in the research that tells us that it takes really 3 to 6 months for the brain to get well enough. And so let's go back to Dr. Mark Albanese and Ed Kansian's book talking about treating addictions as the self-medication hypotheses. So what our team is very skilled at doing is making people feel comfortable when they come into treatment, allowing them to have a safe place to get well, and affording them the time to get well, but to be able to really go down to that underlying issue. And I would have to say 100% of the people who come into our treatment program come to us with an underlying issue of some form of pain. And now that pain may be anxiety, it may be depression, but it also may be trauma, it may be issues around sexual identity, for that matter. Pain, whatever that pain is, we like to allow people to feel safe enough, to stay in treatment long enough, to look at the underlying issues, and in most cases, that is what is driving the substance use, Is there a genetic component? Of course there is. And maybe that's something that needs to be addressed as well. But when people are at high risk, let's find out why, and let's allow them to feel safe enough to go down, to look at that pain, to look at that underlying issue, and feel comfortable enough to talk about it. Did that answer your question?
It absolutely did answer my question. Okay. And another component of that, and I've experienced this firsthand through the SAFE Coalition, is it often, I hear people, there's not enough beds in the state, the Commonwealth, certainly for mass health patients, there aren't. And the treatment that people get, and it's, again, this isn't something that there are evil people on the other end of the line, but it's a cultural thing whereby I heard Woody relay an experience of somebody being asked for their Social Security number when a phone's answered at a detox. And I mean, that's not the first thing you want to hear when you're sick, and it's a life and death matter. You guys treat people much differently when they call Right Turn.
Well, Abby Dean is our clinical director, and she's someone I called a few years into this project Right Turn. And one thing that we really agreed on is that we would treat people with dignity and respect and help them feel safe. And the first thing that comes out of our mouth is not, what is your Social Security number?
Right.
It's, how are you and how can we help you?
Right. How can you pay for this? No,
that's
right.
Well, we're working with insurance companies.
You're right.
It's
not the first thing out of your mouth.
Right. It's not right. So we really want to make people feel welcomed. And I think that Abby and I have been together for a long time, and we both share the same kind of, foundation for Right Turn, which is a warm and welcoming place, and with a high level of professional, a continuum of clinical services.
At what point, though, do people, if I'm someone suffering from the disease, at what point would I would your facility be right for me? Is it early stages of the disease? Is it once someone's been in recovery for a while? Are you residential? Can you say how would, at what point would one come to you in the spectrum of this disease?
Yeah, and so I'd like to think of right turn as being able to move up and move down.
Okay.
You can come in the back door or you can come in the front door. So some people might come to us ambivalent, thinking I might have a problem here. Everyone seems to think I do.
So not even sure. Okay, so that the very okay.
And so they might come in for some individual counseling and find that they need a higher level of structured programming, which we offer every day in our intensive outpatient and partial program, which is 5 days a week.
Can you explain the difference between an IOP, intensive outpatient program, and partial program?
Well, these are terms that the insurance companies probably need to explain to us.
Oh, okay, yeah,
right. Because they created this.
They sure did.
And God love them.
Yeah.
But, an intensive outpatient program would be a standard 3-day-a-week program. A partial program would be a bit more comprehensive. And that would be 5 days a week.
Okay.
So it's really, it's what the insurance companies are willing to pay for.
That's outpatient day program.
Well, and thank you. Yeah, we actually took, good point. We took the need of the client, and we incorporated that in with the partial program. Some people may be coming to us from out of town, or they may be homeless, or they may need some place to go.
What about halfway houses?
So we created a sober living environment we called extended care living, and we only have 9 beds, unfortunately. And currently today it's full, but to your point that there's a great need out there.
Sure.
So people can live with us and benefit from life skills, learning how to take care of themselves, health and wellness.
So that's a fundamental part of the program, right?
But
That's
during the
self-care.
daytime, they're in treatments, starting at 9:30 in the morning.
When you say treatments, can you just be a little, is it group therapy? Is it, and then when do the performing things come into the, if we were to get a view of what a day in the life or a few days in the life of some of these people are, what would it look like?
Yeah, really good question. So when people come in for the structured day program, men start at 9:30, women start at 10:30, because we do some gender-specific piece. The expectation is every day they're going to be in 3 groups, and one of them is going to be a educational group, psychoeducational. One of them is going to be a process group where we're talking about a certain topic and how this relates to their recovery. And third, and most importantly, every day, we celebrate creativity by using.
That's what makes this
so unique.
Yeah. So they'll be in and these groups are facilitated by master's level clinicians. We have an art therapist who is absolutely amazing. And Jen does a terrific amount of trauma work through her expressive therapy groups. I'm going to channel Jen for a minute here. Where she would say that sometimes people have trauma or memories that were pre-verbal, that experiences in life that they can't talk about because they don't have a language yet. And so what Right Turn does is provide them with a place where they can develop a language and begin to open that door, and these covert issues can come up in a safe way and allow them to surface and allow them to be expressed through an art group or a music group or a creativity group, a writing group, photography, whatever group we're running, and then be able to take that information into individual therapy, right? So it kind of expedites the process where someone may not be able to access that information so quickly in other treatment programs. We find very high retention rate and success rate with people being able to access that information, assigning some language to it, and be able to talk about these things that are kind of deep, kind of covert, hidden issues.
Yeah.
Does that make sense?
It makes total sense.
Okay.
And it's
And that
actually,
could be depression.
Sure.
That could be anything.
Sure.
It could be trauma,
Sure.
and in most cases is.
Yeah. And you know, just as as someone who's been traveling around looking at treatment centers, listening to people, treatment modalities, seeing everything from a love you till you love yourself to a break you down until you're broken and then build you back up again modality. You know, this is intriguing to me. This is really, really intriguing. I've been on YouTube. I've seen some of the performances that you do on Saturday nights.
Yes.
So these happen to be musical performances that I've watched. But as Woody says in some of his printed literature and verbally, that you don't have to be someone who comes in with a Berklee School of Music understanding of guitar. You don't have to be necessarily a talented musician or artist. Everybody has a creative and expressive
Everyone's
side, correct?
creative.
Yeah.
Correct.
So you're looking not to engage just those creative artists. You're looking to engage people.
Well,
this
I mean, that's an
process.
interesting part of our story, because originally, years and years ago, going back almost 15 years, our original mission was, creative treatment for creative people. But we've found that our treatment really is helpful to anyone who walks through the door.
Sure.
And so we've really now it's a creative place for recovery. It's a model of treatment that has a high success rate.
That's what I was
for
going to
anyone.
ask you about, because we know we talk often about the relapse rate, and that this is such a terrible disease because it takes a long time for the brain to change back. And so what you're telling us is that you're seeing success, that you're seeing that because people are connecting and they're bonding and they're developing self-confidence and they're understanding the emotional issues that are underlying this disease, that you're seeing success and fewer relapse.
Well, maybe we need to talk about success for a minute.
Yeah.
As an
That's a good idea.
interventionist,
Yeah.
I judge myself, and I like to be successful, and I judge myself and when I see families get well. When it's measurable difference in the family getting well, because that's so important to me. When an individual comes into the program, we might judge or measure their success by the retention rate. Most people go into treatment and they have this, I'll be in here for a week, or I'm 28 days and I'm gone, but what if we were to make this a safe place for you to come, stay, and get well? And the research would support that 3 to 6 months, your brain will actually start to get better.
Yeah.
Not get better. But if we have around a 5-month retention rate where people actually start to really show signs of breaking through early stages of post-acute withdrawal and alexithymia, where the brain has this inability to experience pleasure and connect feelings and put that into language, and they're beginning to get to a place where their brain is healthy enough to actually stabilize and make better decisions.
Right. And that's really interesting to me, because many IOPs that I engage with are talking 5 to 6 weeks, okay, of a commitment. Now that may be insurance-based.
That's what the insurance companies told
Thank
me.
you. So I thought so.
So I was born at night, but I wasn't born last night.
Right,
And
right.
also, as someone with long-term recovery,
Right.
as of today,
Yeah.
27 years,
Congratulations.
6 months, and
Fantastic.
3 days.
Great.
But who's counting? I know that the brain doesn't get well
Sure.
in 28 days. I know for me, it took several years
Right.
for me to be well enough to start to handle things differently.
Right. Woody, one question it just came into my mind. I have to ask it now or I'll forget. What are the signs that somebody's entering recovery? What is it when you see somebody starting to do, you say, aha, we're starting to make real progress? And I'm talking about that period that you just mentioned, that 3 months, and starting to get into a little bit longer term use. What types of behaviors do you see?
Well, I mean, that's interesting. So, I like to see or hear people start to make different choices, going into their cell phones and removing all those people who they thought were friends.
That's big.
Is that big?
That's big.
Right. Being able to, maintain a healthy diet. Sleep is one of the number one indicators, and I say that as someone who recently had to go through my own recovery from a medical issue. Sleep is so crucial. One of the first issues I like to tackle in recovery. So a reduced level of cravings, and hopefully the brain is getting well enough that it's not being held, that they're not obsessing over and experiencing cravings on a daily basis. We do have medications that can help with that.
Just going to mention it.
I say, geez, if it helps this person, let's talk about this medication. Doesn't necessarily mean we're going to use it, but we could. And truthfully, if the truth be told, and Abby, Dean, and I laugh about this all the time, we prefer that they be alive.
Yes. And another thing that I heard Woody say as I was getting ready for the show and watching an interview on him is that, relapse often happens. Right turn, unless I heard you wrong, your policy is not to dismiss somebody after a relapse. It's not to say, and you made an analogy, I thought it was a wonderful analogy, it's like a diabetic and they happen to see a piece of chocolate cake. They eat the chocolate cake, the doctor doesn't say, well, I can't see you anymore.
Well, yeah, I go to a nutritionist who's helping me look at my diet, and if I walk in and say, I ate that donut, I told you I wasn't going to eat the donut, would she say, oh, I'm sorry, I can't help you anymore? And the answer is absolutely not. Now, I don't want anyone to think that I feel that relapse is a part of the process.
Okay.
Relapse is not a part of the process of recovery. Relapse is a part of the process of addiction. If your brain is still in active addiction, you're at high risk for relapse. That's a very, very important piece.
It's critical because I'm a facilitator with Learn to Cope. I'm with parents all the time, and we often hear the following: relapse is just part of the process of recovery.
Yeah, I'm sorry, but I need to stop that and say no, it's not. And people do not have to hit bottom. They don't have to die in order to get into recovery. There are interventions that work. But let's get back to your point here. Relapse is a reality. People come to us in various stages of readiness and willingness to get well. A part of them wants to get well, but a part of them is very, very sick.
Sure.
So the person I want to speak to is the person who wants to get well. It's too easy to talk to that person who's very, very sick. I already know what they want. I've been there. I know that, right? One of our clinicians, John Cohan, always tells the pun, hey, I've seen that movie and I know how it ends, right?
Yeah.
So, we want to help people get well, and we don't want to penalize them. We want to make them feel comfortable and welcomed, if that makes sense.
It makes total sense. Woody, you have helped thousands of people over the years?
Right Turn has.
Right Turn.
I want to be very careful here.
I'm sorry.
I know that I'm the face of recovery, and Dr. Ann Alonzo, when she wrote that check, she said, you're going to open the doors, you're going to turn on the phone, and this is what you're going to do, and get comfortable being the face of recovery for this agency. So I'm the face of recovery, and everyone loves Right Turn, but it's really a we thing. We have an incredible staff that's been together for a long time, and the culture of the team and their willingness to step up and handle difficult cases, as you indicated. Sometimes we're dealing with mental health issues, right? And that the substance use isn't going to go away unless we look at that.
Right. And I'm going to encourage everybody to go on right-turn.org and take a look at the team that Woody's talking about. I did. It's incredibly impressive. The therapists that are on board, the staff that's on board, his board of directors, or Right Turn's board of directors. So thank you for clearing that up. But you at Right Turn, you all, have helped literally thousands of people. The rate is, 500 or so come through and access your services every week? Or am I... Is that something I heard? Roughly?
Well, including our Saturday night music performance series, and every night we have meetings. Thursday night is the Artist in Recovery group, which is open to anyone in the public.
Yeah.
Anyone's welcome to come Saturday night or Thursday night or Friday night. These are wonderful ways to come maybe through the back door. And literally through the back door of the clinic at night.
Yeah.
But it might be your first exposure to a community of people. A community. Let's just leave it there.
So if I'm from a family and I have and trying to help my maybe young adult get placed someplace.
Yes.
If they call you, are there openings right now? What will insurance cover it? I mean, you think of all the questions that they ask. Is this something people can access now, a service? Is it knowing the beds aren't available right now, because you said there are only 9 and they're all full, but
currently full today.
But
just today.
Yeah, but the insurance will help with this, just given the issues and the questions we hear, like through Learn to Cope, and is it simply a phone call, and that they can get access to this wonderful organization?
Well, thank you for the kind words, and I think that, Doctor, if I were completely honest with you, we are trying to improve access to treatment for people. Our phones ring, and we want to be able to say, yes, come in.
Right.
We want to help you. It must have taken a lot of courage to pick up that phone and say, I think I need help. So congratulations on that. My job and my responsibility right now in this world, on this planet, is to develop relationships with insurance companies and say, look, we've been around for 15 years, and we have a very high success rate and retention rate with people getting well, and it's not done in 28 days. So can we have a conversation about longer-term treatment and the effects of longer-term treatment? If someone wants to come in for a day or a week, great. If they feel comfortable and they want to stay, even better. But we will always say that we recommend that you stay for 3 to 6 months. So now the insurance companies are going to look at me like I'm crazy. But we are currently in network with Blue Cross Blue Shield, with Tufts Health Plan. We do accept other private insurances, and we're trying to kick the can down the road here and trying to improve access to treatment.
Like Mass Health and...
Well, Mass Health looked at us a while ago, and they thought that we were too small. But that...
Sorry.
But the thing is that it's really a relationship building piece for me.
Most definitely.
And so that's where I am today, is that people are catching on that we are an evidence-based program.
I was just going to say evidence-based, and Patrick Kennedy is still fighting this insurance parity fight through the Kennedy Forum and work that he's been doing. Mental health parity came along. I was in the insurance business back when mental health was not covered as any other illness.
You were?
I was.
Oh, wow.
And it wasn't a fun thing, especially when I had a family member suffering from mental health get substandard services because of a lack of assets. And that's what we're talking about right here. And we could go on and on and on about the need for parity, but Woody is certainly an advocate and working with insurance carriers to get more coverage. I will tell you that I personally called Woody 3 times. I do not know Woody Geissmann until now, and I'm very happy to make your acquaintance. I met him just briefly.
I remember you, Jim.
Hasn't met anybody else since we first met.
Yeah.
But he picked up the phone every single time and called me back every single time. Right Turn is extremely accessible. Woody, how are you funded? And because I know that you do try to make it affordable for those that don't have insurance, and you do have somewhat of a financial litmus test that allows people to access you if they can't afford it. In some ways?
Yeah. So how are we funded, or how are we not funded?
Yes, how are you not funded? Yeah.
We don't have any. We are licensed by the state of Massachusetts, by the Bureau of Substance Abuse Services, Department of Public Health, and we are a CARF accredited program, which
CARFA is?
CARF is the certification for, if you're a hospital, you get a JCO certification. If you're a clinic like us, you get a CARF accreditation.
Thank you.
Which means we're legitimate.
Yep.
For many, many years, as we were building this program, and really, trying to answer the needs of the people who came through the door. What do they need? Oh, they need more structure. Let's establish an IOP. Insurance companies aren't going to recognize us yet, but we're going to start this, And so every year we've thrown fundraisers because we are a 501c3 nonprofit, and we do take donations, and I hope your audience is listening. Because it is 100% tax write-off for you to make a donation to the cause, and it's much needed more now than ever.
Absolutely.
We've been in a position where, because of my connections to people in the music business, we've had Alice Cooper show up to do a performance. We've had Chuck Berry.
What?
What?
Yeah, what is right?
We had Warren Haynes from the Allman Brothers.
My favorite guitarist. Though.
Can I tell you, of all the musicians in the world that I've performed with, basically unrehearsed, walking on stage with Warren Haynes was just like butter. It was
can't
amazing.
imagine. And you've walked on stage with a lot of them,
So every year we've done fundraising events and accepted donations. We are not receiving any state contracts. I do go after occasional grants, but that has its limitations because I'm wearing too many hats, and I'm currently trying to not wear so many hats so that I can be out talking to people like you and raising the awareness for responsible treatment.
Right.
Right.
And that is the key. So, folks, right underneath me right now, I hope you, or underneath Woody, you will see the web address for Right Turn. .org. Again, it's right-turn.org. And the phone number, Woody?
781-646-3800.
That's 781-646-3800.
And there will be a series of prompts if you need intake or,
I'll tell you, it's very accessible. There's no Barry Manilow music on hold, which I was very thankful for. I'm very sensitive to hold music. But quite seriously, a great organization.
Why so down on Barry Manilow?
I don't know.
Come on.
It's a thing that I've had from, I think I lost a girlfriend during Mandy. But, in any event, as you can see, Woody's a great guy, easy to talk to. They're a wonderful organization. And if you are inclined to donate, donations are gladly accepted. There is a tab on the website itself, or if you want to talk to somebody about donating, or if you want to tour Right Turn, if you want to come down and visit. Is that something people can do?
Absolutely. And we would welcome you on any Saturday night to come down and listen to some music in our the Right Turn Performance Center. We call it Right Turn Live, a sober cafe. So it's a wonderful, safe place for people in recovery to come and see music, hear music, or maybe play music.
Well, it's interesting you say that because I heard you make that offer before, and I have some people in long-term recovery that are very good friends of mine. We're headed down in a couple of weeks. Woody, what is the address of that cafe?
So we're at 440 Arsenal Street in Watertown. Earlier you said Arlington.
I beg your pardon.
No, it's okay. We were in Arlington for 12 years and we relocated to Watertown because we needed more space.
So that's 440 Arsenal Street in Watertown, Saturday evenings, every Saturday evening?
Every Saturday
what time?
From 8 p.m.
8 p.m.
until 10 p.m.
Great.
Park in the parking lot, just pull behind the building where there's a parking lot, and the door is right there off the parking lot.
Woody, I got a couple of other quick things before we close. One is your focus on family and family wellness. Is very, very strong at Right Turn. Can you talk to us about why that's important and how you go about that?
Great question. And, if we're trying to help an individual get well, we don't want them to go back into a family that is not well. And sometimes the family needs to get well before that individual will get well. There's plenty of research that would support that. That if the family says, you know what, I need to get well. We've been living this way for a long time. and this family needs to make a commitment to getting well, then the individual who may have been ambivalent or resistant to treatment is more likely to say, me too. Does that make sense?
It makes the world
But
of
we
sense.
don't want someone to get well and then for them to go back into the same
Sick
family
environment.
dysfunction.
Yeah, sick environment.
I hope that's not too derogatory.
No, it's
Not at all. Having lived it and working with it right now, I think it's a critical understanding, and the sooner families come to grips with the fact that the whole family gets sick during this illness, and the sooner they get on a road to recovery, I believe the whole unit stands a better chance. Does that?
Well, good point. And I just want to add one thing to that,
Sure.
Jim, and that is that often, very often, some of the behaviors or family dysfunction can actually be linked back several generations. you know.
Interesting.
So this is not something new, and it kind of takes the sting out of it when you talk to a family and say, let's go back 3 generations. Where were we? Was the great-great-grandfather or great-great-grandmother depressed or an abusive alcoholic? Was there trauma in this family that has been handed down from generation to generation? A real simple kind of example is, I'm married to a beautiful Jewish woman. And every day she says, "Oy, I feel guilty." Why do I feel so guilty? Well, let's go back several generations to a time where there were members of her family that experienced survivor's guilt.
Right.
And so how did that rewire their thinking, their brains, physically, and how was that handed down genetically and or behaviorally from generations to generations? And is my wife still living the Holocaust?
My goodness.
What a powerful component,
Isn't
though,
that
isn't
something?
it? Yeah, that's.
I've never heard it expressed that way,
Yeah.
and that's
Well, that's
really
what the
something.
research teaches us. That's what we learn.
Well, Ian, this has been a terrific,
Absolutely.
terrific half an hour, 40 minutes with you, Woody. I can't thank you enough. Is there anything else that we're missing about Right Turn that we ought to let folks know?
I think you've covered pretty much everything. I'm just grateful to be able to talk about this and make this conversation, open up this conversation to people who might be afraid to talk about it.
Right. Well, we're so grateful for that. Folks, one of Safe Coalition's core missions is to reduce the barrier of treatment. And as you can see today, that is shared by rightturn.org. Again, the website right-turn.org. So my name is Jim Derrick, and I just want to remind folks that if you find yourself in crisis or you need help, or a loved one needs help, please feel free to call our resource line at 508-488-8105, and the Coalition will be certain to try to help you. In addition to that, we can be found on the internet at safecoalitionma.com or Twitter and Facebook. So for our guest, Woody Geissmann, and Dr. Ann Bergen, I'm Jim Derrick saying thanks so much for watching.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.